Have you been diagnosed with Lyme disease? Or are you wondering about Lyme disease? If you have it, how long does it last? Well, then this is the video for you. Hello everyone, this is Dr. Jason West and welcome to the Lyme series. This video series is designed to give you information about one of the most misdiagnosed, mistreated, misunderstood diseases available, and that is Lyme disease. And we're going to talk about Lyme disease. How long does it last? Now, Lyme disease, it's a lonely condition. What I mean by that is there's so many different presentations. There's confusing about the testing. There's confusion about the treatments. There's confusion about where it comes from. This series is designed to give you at least my perspective on understanding this disease, where it comes from, how you get it, what you can do about it. And so let's talk about one of the most common questions that I get asked is how long does it last? And the answer is it depends. So let's clarify what I mean by that. Lyme disease can occur in acute situations, it can occur in chronic situations. Where it comes from is the traditional medical understanding of Lyme disease is that it's a vector-borne illness, which means you get it from a tick. A lot of people get a bullseye rash, then they get flu-like symptoms, their joints can hurt. The conventional medical treatment for that is a series of antibiotics, usually doxycycline or Rocephin. A certain number of people have lingering symptoms. And sometimes that's diagnosed as PTLDS, which means post-treatment Lyme disease syndrome. I see Lyme disease with a lot of chronic residual problems that get misdiagnosed as autoimmune problems because I think that the Lyme bacteria can get into your nerves and cause nerve flare-up, and you can get peripheral neuropathy, you can get, quote, MS umbrella symptoms, unquote, you can get Parkinson's, brain fog. I think those are all reasonable factors. Does everyone that have Parkinson's have Lyme disease? No. Can it be a factor? I think that chronic infection causes a lot of long-term residual health problems. Now, sometimes people treat it with antibiotics, sometimes they treat it with immune system stimulation. Some people just suck it up and live on willpower or a combination of herbs and vitamins and minerals and homeopathics. And here's what I tell people when it comes to treatment. If you're improving, then you need to keep doing the therapy. If you're plateaued or you're going the other way, what you need to do is you need to keep searching. And the internet is a wonderful tool and a bad thing because it gives you great information. It can also give you poison or misinformation. So talking about Lyme disease and how long it lasts is so dependent upon the symptoms and the symptom presentation and the possible organ involvement and the organ damage. And what I mean by that is when you have chronic infections and it's in the muscles or it's in the joint or it's in the nerves, what happens is I think it's like a little, simmering pot of infection, and the immune system comes in to get rid of the simmering pot or infection. And what happens is that the immune system isn't quite strong enough. It creates inflammation in that pathway or system, and it can irritate the joint or irritate the nerve, and the immune system isn't quite strong enough to get rid of it. And so what happens is this lingering problem. And an anti-inflammatory approach where you're just taking over-the-counter non-steroidal anti-inflammatories or cortisone or prednisone or immunomodulator therapy, I think long-term is detrimental because it knocks down the ability of the body to respond. And then what happens is you have a long-term or an extended healthcare condition. So you want to stimulate the immune system to make sure that the immune system is strong so that you can get over Lyme. Now, I like to tell people this analogy. It usually takes about 90 to 120 days for the blood basically to come out of the bone marrow, go into circulation, then it partially dies, it kind of goes over the spleen and gets recycled, and then basically it starts all over again. So a life cycle of a red blood cell is 90 to 120 days. I believe that there are a couple phases of Lyme disease. There's the spirochete phase, the spore phase, the intracellular phase, the budding phase, and the biofilm phase. This is not accepted in the traditional medical circles. And I get that information from several different books and studies. I think there's multiple phases of Lyme. And why that's important in understanding how Lyme lasts is because it usually takes a series of blood turnovers or blood cycles to get someone to improve. Now, it doesn't mean when you start the treatment that you can't start feeling better, although typically with the many treatments, people feel a little bit worse before they start feeling better. And if perfect health is here and you have Lyme here, it's not a straight line shot. to get better. What happens is you go up and down and you have roller coasters, and it's depending on your stress, your food intake, your mind, body, your relationships. There's so many factors that can be associated with it. And stress doesn't cause Lyme disease, but stress is like throwing gasoline on the fire and having these flare-ups, and then you die down and you have these flare-ups. And so the timing for Lyme disease, it usually takes anywhere from 2 to 5 or 6 blood cycles. And if a cycle is every 90 days, it can take 6 to 15 or 18 months. And unfortunately, people with Lyme disease, I kind of tell them this story. In some regards, it's kind of like winning the reverse lottery. All the factors line up. Maybe you have some weak genetics. Maybe you've had a lot of stress. Maybe you've had trauma or abuse that dampens your immune system, and then the infection comes in play. And what happens is you have to be more vigilant than normal people. And when it comes to Lyme or autoimmune or cancer or anything else, I have so many people say, why me? And the answer is, I don't know exactly why that's you, but I will tell you this. If you want to have more stress, if you want to have a longer term condition, is start comparing yourself to other people. I know that that's not the best thing to make people happy or make people healthy, but don't compare your health to other people. I just had this incident happen in the office where someone come in and they said, you know what, it's so unfair. My husband can go out and drink, tons of Mountain Dew, and he can have pizza and nothing ever bothers his stomach. He's a perfect human specimen, and he just doesn't really take care of himself. And I have to be so careful. I have to be gluten-free. I have to be dairy-free. I have to be soy-free. Everything has to be organic. It has to be fresh. It takes so much energy and it takes so much effort to literally function at 50 or 60% of what my husband does, and he doesn't have any of those factors. And I tell him, you know what, I don't know how to answer that to make you feel better other than to say this. When you compare someone else's physiology to your physiology, it has a tendency to make you feel really, really unhappy. And if you get nothing else out of this video, what I always encourage you to do is to just recognize that everybody has their own path. Everybody has their own struggles and problems. And if you see someone that doesn't have problems, it means that you don't know them very well. And unfortunately, your problem in life, or your test that God or your supreme being is giving you, is that it's your health. The best way to manage that is to just say, this is how I function, and I don't compare myself to anybody else. Now, I got a little bit off topic about how long Lyme disease lasts. The answer is it's all over the place, depending upon the individual characteristics and individual biochemistry in response to the disease. But if you have a confirmed case of Lyme disease, or you suspect you have Lyme disease, usually that battle is anywhere from 3 to 18 months for a lot of people, and unfortunately for other people, it's a lifetime commitment. I wish there was a better answer for it. Sometimes that's just the way it is. There's the way to treat Lyme disease is to get everything balanced and everything in the proper place as best you can, recognizing that we all have a roller coaster of problems and stress and trauma and eating. And the healthier and alive your food is, the healthier and alive you are. If we can manage stress, you can't make it go away. There's no magic pill or lotion or potion that makes stress go away. But if you can reduce and manage your stress levels, have healthy relationships, and then do everything possible to get your hormones, your biochemistry, your biomechanics balanced, you have an excellent chance of improving your health. That doesn't always mean 100% cure. Unfortunately, sometimes that infection does long-term damage to the organs and tissues and nerves, but I believe that there's always hope. It's not me saying it. There's hundreds of video testimonials on our blog, Daily Dose Vitamin H, and there's a really neat book coming out called I Am the Hero of My Own Story, of people beating their disease and not listening to them. And them means the other people that are deliberately or on purpose or accidentally in your life are telling you how to manage your life and how to fight your disease. This is a long-term chronic disease that can create some loneliness, but I believe that there's always hope. So I'll see you on the next video in the video series about Lyme disease. This is Dr. Jason West.